There's two things that clicky hips are. Lots of people have hips that click and make sounds, and that's usually because of movement of your muscles over the bones in your hips. The clicky hips that need treatment from myself and our team are the children whose hips are not so much clicky as clunky. It's the movement of the ball of your hip joint going in and out of the cup part of your hip joint. And that's what most people call clicky hips, but we call it, very posh name, developmental dysplasia of the hip, or DDH is what we all call it.
How common are they?
Well, there'll be about 1 in 1,000 babies born who will have DDH. So not very common.
How are babies born with clicky hips?
Clicky hips, or DDH, is the development of the cup part of the hip. So it's those babies who are at risk of having DDH are those who have been a bit squashed inside their mum's tums, and those babies who have been breech, and that means that instead of them being head down in their mum's tums, they're actually feet down or bottom down, so they're the wrong way up, and that squashes their hips. There's also, they think that there's a family history, so they think there's a gene that goes along, which is your programming, that some people are more likely to be programmed to have DDH.
Is there a problem with how the baby is formed?
Technically, I suppose there is, yes. It's what it is that normal development is that the cup part of the hip starts off very shallow, and then as the baby gets bigger and is getting ready to be born, that cup gets deeper and deeper. And in these children that have DDH, that doesn't happen. It stays very, very shallow.
Are girls affected more than boys? If so, why?
Yes, they are more affected. It's much more common in girls than in boys. And nobody really knows why. But they think it's because girls are naturally more bendy than boys. If you ask a girl to bend their arms backwards or their knees backwards, they're much more likely to do that. And that's something to do with hormones. And they think that girls are more bendy and are more likely to be squashed inside their mum's tums, whereas boys will take as much room as they want.
How can you tell if a baby has clicky hips?
There's lots of ways. The first way is that when any baby is born, the doctors will have a look at their hips and will do special movements that are trying to push the hip in and out. Now, of course, most children, that doesn't happen. The hip doesn't move. But on some children, when they do this movement on their hips in the hospital, they will feel the clunk. So that's one way of telling if they might have DDH. And then the other way is to look at whether they have been squashed. If there are signs that the baby has been squashed, so their feet are turned in and they're not moving them a lot, that could be a sign they're squashed. If they're breech, so if they're upside down, and that can be discovered with the antenatal scans, so they look in the mum's tums with ultrasound and they can tell which way up they are. And then they'll all be referred, if they think there might be a problem, referred to us here for an ultrasound scan where we look inside the baby and look at their hip, and we do a very accurate measurement of how deep that cup is so that we can then tell if there's a problem.
We've moved into the scanning room and we're going to see where the baby's been scanned.
Going to have a look with the ultrasound scan to have a look at the muscles and tendons and things in your arm and find the bright white lines at the edges of your bones, and if you move your fingers, see what happens. Can you see that moving?
Yeah.
Like almost like a river, isn't it? But that's your muscles your tendons moving.
So you can see this is one of your bones here. You can't see much behind it because the ultrasound is stopping it. But where there's a gap, you can see a bit more.
There's your joint. Try moving your wrist, see if we can see your joint moving. Not quite. You can see your wrist joint there. There you go. And that's what they get on, that's what the babies have on their hips, this gel.
Now describe what that sounds like, Tony. What that feels like.
Feels all weird and sticky.
It wasn't cold though, was it?
No, we have a bottle warmer for the gel.
Cold on your belly.
And does it still feel damp
Yeah.
even though it's been wiped off? So.
How do you make a clicky hip better?
We put them in a little harness, and actually it's the baby's body that makes it better. This harness does, it's called a paediatric harness, and it holds the baby in a little frog position. So they look like little frogs with their legs out and up. And that holds the ball nice and firmly in the little shallow cup. And then the baby kicks around, and then that stimulates that bone to get deeper and deeper, just like it should have done when they were in their mum's tum, but they were squashed in the wrong way. We put them in the right way, and then the body does it all itself. So we don't do very much but hold them in the right position, and then the baby's body does all the rest for us.
How long does that take?
Well, it depends on how bad and how shallow the cup is. Those that are shallow but the ball is still where it should be in the socket, then they can take a minimum of 6 weeks. Mostly it's 6 to 8 weeks in this harness that has to stay on all day. They're not allowed to come out for baths. They have their clothes over the top. And then those that are more severe, where the ball has already slipped a little bit out of the cup, then they often take a lot longer. If one baby has been born with DDH, then you now have a family history, and we can't be convinced that there isn't a genetic reason for that. So we scan any baby, sister, brother, or even extended family. So if a mother has a baby who has got DDH that has been treated, then we usually advise the whole family that when they have other children, they should be scanned, just in case, even if they feel all right and look all right, they should be scanned, and that other members of the family, when they have children, and when the baby has children, that they should be scanned, just to make certain, because there isn't any way of telling for certain from just looking at them.
How soon after being born should you be checked?
We try and check all the babies between 4 weeks of age and 6 weeks of age, and the reason for that is that the paediatric harness that we use to treat DDH works much better on a smaller baby. So it's really important that if your baby has been referred for an ultrasound scan of their hips, that you try and make the appointment that's been given to you, because if there is a problem, it can be so easily sorted out. But as the older the baby gets, the less likely that harness is to work properly.
Thank you for your time.
That's all right.